National Nurses United by Larissa Decker, Caroline Huntress, Delina Malo Hoovera, and Ann Taylor. DC-based 501c5, National Nurses United is the largest union and professional association of registered nurses in United States history, with over 185,000 current members. Its focus is creating and amplifying a unified voice of direct care nurses and patients in national policy. Created in 2009, its roots reach back deeper. The California Nurses Association / National Nurses Organizing Committee broke from the American Nursing Association in 1995 in order to fight more aggressively for nurse and patient advocacy. They merged in 2009 with major advocacy and unionizing groups United American Nurses and the Massachusetts Nurses Association. By creating one large organization, they pulled nurses into a single organization capable of exercising influence over the healthcare industry, governments, and employers, to have a bigger voice in the national healthcare reform debate. Together, their strength in numbers and shared visions would begin to radically change nursing. Foremost, NNU advocates on all public policy matters relating to safe care in nursing practice, protecting and advancing the interests of nurses and patients in all 50 states. NNU's first-year achievements were significant. They organized 6,500 nurses into NNU in Florida, Illinois, Iowa, Nevada, and Texas. They sponsored major national legislation to improve nurse practices and patient safety, including minimum nurse-patient ratios, which was modeled on a successful law passed by the California Nursing Association / National Nurses Organizing Committee in 1999.
National Nurses United realizes that when nurses spread themselves too thin, it results in poor health outcomes for patients, unsafe workplace conditions, a lack of job satisfaction, and nurse burnout. The NNU has spearheaded campaigns in support of nurses and patients through their advocacy work in occupational health, addressing workplace violence, supporting healthcare for all, nurse-patient ratios, patient advocacy, and acknowledging nurses as direct care providers. NNU's advocacy for nurses and their patients has led to several initiatives that were identified as issues at the local level and have been brought to state legislatures and Congress for action. The NNU works diligently to enact standards of care, whether it's nurse-patient ratios, personal protective equipment, or asking the Occupational Safety and Health Administration to require employers to have a workplace safety plan in place. NNU first sounded the alarm over proper PPE in 2014 when 2 nurses contracted Ebola due to improper PPE. At the time, Deanne McEwen, nursing practice specialist for the NNU, implored legislators to enact a national PPE standard, saying, "We are at the most risk for exposure, so shouldn't we have the highest level of protection?" NNU is currently working to create PPE protocol standards for nurses who may be exposed to aerosolized particles while working with COVID patients. Nurses working with these patients are often exposed to viral particles during intubation, extubation, and as well during normal patient care, since particles travel freely from a patient's mouth into the air. PPE may also be contaminated with multi-drug resistant organisms. In addition to providing adequate PPE, employers must provide education on the proper way to dispose of contaminated gear. Although there is no official list, it is estimated that approximately 3,600 healthcare workers died in the first year of the pandemic, according to the NNU. Due to supply chain issues, many hospitals rationed N95 masks, gowns, gloves, and shoe covers. Some nurses were forced to wear bandanas and trash bags that prior to COVID would have been unacceptable by existing safety standards established by the Joint Commission. The NNU has become a collective voice prioritizing safety over profit, tackling issues brought to them by the boots on the ground nurses that make up their membership. They have successfully won standards for safe patient ratios in California and are hoping to implement limits on patient assignments through each state legislature. Research by the NNU says that staffing one nurse for 8 patients results in 5 additional deaths per 1,000. They advocate for a ratio of 1 nurse for each 4 patients. Labor expert Harley Shaken says they've emerged as a powerful voice in defense of people who receive health care treatment. And he also says of the NNU that nurses have a pioneering role simply by showing that a small union can have a very large impact if it is able to define the debate and if the message resonates with the public.
Workplace violence is exactly as it sounds, the threat of violence against workers. This can include verbal abuse, assaults, or even homicide. Healthcare workers have long been identified as a group that is at an increased risk for workplace violence. Recently, at a local Maine hospital, a dementia patient became agitated and began punching staff. In 2010, a nurse on a psychiatric unit was strangled to death by a patient. A statistic from OSHA says that while healthcare workers only account for 20% of all workplace injuries, they suffer 50% of all assaults. Healthcare workers are the second most vulnerable group for workplace violence. Workplace violence can cause extensive physical, emotional, and financial loss for all involved. Employers must pay workers' compensation for injuries. Nurses lose days of work and increase staffing shortages. Workplace violence can also cause psychological distress and feelings of being a bad nurse. Increased violence equals low job satisfaction, which leads to more RNs leaving the profession and growing costs for employers to train new nurses. Workplace violence can also cause extra stress for RNs, which leads to higher incidence of medication errors and poorer patient outcomes. Everyone is hurt by workplace violence. NNU has recognized the devastating effects that workplace violence has on all parties involved. In hopes of slowing what they refer to as a growing epidemic, they petitioned OSHA for a standard to prevent workplace violence. In 2019, NNU was behind the new legislation entitled the Violence Prevention for Healthcare and Social Workers Act. This requires healthcare employers to involve employees in creating unit-specific violence prevention plans, requires employers to evaluate risk factors and provide resources to handle threat potential such as appropriate staffing, security personnel, and alarm systems. It also eliminates retaliation of employer to employee for reporting violence and requires a fast response to violent acts as well as prompt and continued treatment for victims.
NNU organizes around the following principles. Advance the interest of direct care nurses and patients across the U.S. Organize all direct care nurses into a single organization capable of exercising influence over the healthcare industry, governments, and employers. Provide effective collective bargaining representation to all NNU affiliates with the goal of improving economic and professional interests of all direct care RNs. Expand the voice of direct care RNs and patients in public policy. NNU continues to engage in the national healthcare reform debate and in electoral campaigns all over the country, notably that of Senator Bernie Sanders during the presidential elections of 2016 and 2020. NNU vigorously supports a healthcare system that covers every person in the country, known as Medicare for All. As part of this project, we had an opportunity to interview Mr. Todd Ricker, labor representative at NNU in Maine. He shared that NNU has no set criteria when deciding to support an initiative. Instead, they vary from place to place according to the needs of the nurses and patients in that particular hospital or state. NNU is driven to improve working conditions for nurses and safety for patients, both of which are intertwined. When a nurse has all the needed resources at hand, he or she is able to provide safer and more comprehensive care for patients. For example, making sure nurse-patient ratios are implemented at hospitals, staffing and scheduling mechanisms to make sure nurses are well rested, not tired or overworked. This will reduce the potential for harm. NNU is currently working on initiatives to make sure that OSHA, Occupational Safety and Health Administration, inspects all HCA, Hospital Corporation of America owned and operated hospitals, and to issue citations for willful violation of workplace safety hazards, which could reasonably be expected to cause death or serious physical harm. NNU wants OSHA to address dangerous conditions such as failing to notify workers when they have been exposed to COVID-19 and making sure those who are sick or may have been exposed are not pushed to continue to work. They also support worker eligibility for compensation through their employers, including coverage of expenses should they fall sick with COVID-19. Many hospitals have made the argument that nurses testing positive may have contracted the virus somewhere else, which removes the hospital from responsibility for working conditions when exposure happens at their facility. Membership in NNU is open to any nurse regardless of experience level or hospital affiliation. Any nurse can become an associate member by filling out an application on the NNU website and paying a $50 membership fee. NNU has an international presence. They are actively engaged with Global Nurses United, including unions in 29 countries from Canada to Malawi. Todd Ricker emphasized that the biggest and most important thing MSNA nurses are doing right now is helping to organize their colleagues at Maine Medical Center. Once nurses organize as a group and join MSNA NNU, they have the right to bargain as equals with their employer over their pay, benefits, and working conditions.
As the largest union of registered nurses in the U.S., NNU is a valuable player in advocating for the creation of health policy focused on safe care and advancing interests of practicing RNs. NNU's involvement in health policy issues such as establishment of safe nurse-to-patient ratios, addressing workplace violence, proper use of PPE, and supporting Medicare for all have improved patient outcomes and overall public health. NNU has impacted practicing RNs by creating a unified voice where nurses can advocate for change, including continuous improvements of working conditions, better pay, time off, continuous training, and advances in safety measures.